Hi, my name is Truong, and I would love to tell you a little bit story about myself. So I started my nursing career a little bit later than a lot of people that in our class. I started out in my other career as a financial advisor in auto lending industry in early 2000. Two, however, after 10 years that working in the industry, I find myself that I did not enjoy doing what I did. So I go back to school and look for my callings. And now I'm working on my nursing career, and I believe this is my true calling for my life. So here I am. And potentially going through this nursing school, I will be able to become an RN, and I would love to work in an operating room as an OR nurse. I love to learn, so I want to see more inside of the human body. That way, I can gain a better understanding on how we are working. Along the way, I can also help saving lives. I understanding that nursing we helping life in many different ways, from taking care of our patients to giving them medications that they are needed as the doctor's orders, or just help them do nursing care. Operating room nursing is a specialized field in which nurses provide quality care to patients before, during, and after surgery. An operating room nurse must have the same knowledge and skills as other registered nurses, but certain skills are even more invaluable during surgical procedures. OR nurses are specialized registered nurses, and depending on the situation, they may act as a scrub nurses or circulating nurses. A scrub nurses hand surgical instrument to physicians, while circulating nurses oversee nursing care during those procedures and ensure the operating room remains sterile. An operating nurse also acts as a connection between the patient and the patient's relative and the medical team. After extensive additional educations and training, an RN nurse in the operating room can become a first assistant and deliver direct surgical care. The education for the operating room nurses is include a standard RN requirements. After obtaining 2 years of operating room nursing experience, I will be eligible to take the Certified Nurse Operating Room as a CNOR certifications examination. And this will be provided by the Competency and Credentialing Institute and the Association of Peri-Operative Nurses. The number one skill is the ability to work as a team. The operating room is a very complex and dynamic environment, and each team members of the operating room team require specific skills. The individual's skills necessary to perform a surgical procedures safely and successfully, which will provide the highest quality to the patients and assure the safety environment for the patient. The number two skill you need to have in an operating rooms as a nurse is excellent communications. The tensions can run high in the operating room, so your ability to effectively communicate with the medical team members in a calm, professional demeanor is essential. And you also need to communicate with the family members of the patients to easing the fear from the family members as well. The importance of effective communications while educating patients prior to their surgery and going over recovery methods after the surgical procedure. The number 3 skill for an OR nurse is a highly organized. A highly organized skill will put a nurse at ease while organizing all the scheduled tasks and all the equipment and supplies in the room, as well as charting during the procedures. Number 4 is being detail-oriented. Being detail-oriented goes hand in hand with highly organized. You must know everything in the room, and you must monitor everything going on. You will be able to find the right equipment for the surgeons in a timely manner, and it does require you to pay attention to detail for the safety of the patient and the success of the procedures. So for my timeline, I will plan to graduate in nursing school May 2021, and after working in the OR for 2 years, so I'm planning to have my certifications for OR registered nurse in 2023. After I get my certifications as an OR nurse, I will plan to go back to school. If my financial situations permit it, then I will be able to go back and get my nurse practitioners. My ultimate goal is in 10 years, I will be able to go overseas or go to places that with populations that is less fortunate to do humanitarian projects to help others that need healthcare assistance. And that's it. That's about my plan. Thank you for watching.